My name is Brett McClain. I am the Executive Vice President and Chief Operating Officer for Sharp Healthcare here in San Diego. I have been in healthcare right at 30 years or so in a variety of different areas. Started in consulting, worked in public health for a while, also worked for Dignity Health before joining Sharp 18 short months ago at the very beginning of the COVID-19 pandemic. Hospital administration is, you're right, it's a pretty broad term. It's a pretty broad kind of category. And I will tell you, over the years, it has evolved as healthcare has evolved. There are always needs for people to run a hospital and to make everything come together, the clinical side, the business side, the regulatory side, all of that. And so there are people that are in hospitals, whether they have a clinical background or not, and they are in leadership positions, really making sure that physicians have the tools that they need, that we're taking care of patients. And what you'll find and what you'll see with healthcare leaders is you'll have a group of folks who are kind of clinically driven and focused and maybe have a clinical background as a nurse or a respiratory therapist. And then you'll have business folks as well, because we need to have, marketing, and we have sales, believe it or not, right? And we have finance and all information technology, all the supporting infrastructure behind that is also has a big requirement for leaders and folks to come together. So I think it's one of the best things about healthcare is you have such a diverse breadth of folks with backgrounds that are just coming together to do the same thing. I will say, when I look back to 1988 or so when I graduated, I wasn't 100% sure what I was going to do. I do have a business degree and then went on to get an MBA. I knew that I liked the way businesses worked. That point, I really liked marketing and finance, and those were my two focus. I was lucky enough right out of school to be selected for a management training program in, believe it or not, the trucking industry, and took that position that kind of they threw you in. You got to work in operations, you got to work in sales, you got to work in finance. And I did move to Los Angeles and did that. And then from that, I got picked up by a very small boutique consulting firm that did a lot of process improvement work in banking and in manufacturing, but also in healthcare. I just, out of the blue, found myself my first assignment being assigned to a hospital. So spent the next 11 years doing that. And that's really how I kind of got exposed to healthcare and just really found my calling and my passion, and incredibly grateful that that happened. I do think it gets back to, in terms of the path and kind of the background and the support and the ongoing education and all of that, depends a little bit on the path, right? If you're taking a clinical path, you may start again as a nurse, right? And then all of a sudden you find yourself doing a great job at that, and you get asked to be a shift supervisor. You do a great job at that, and you're like, well, that'd be a great manager. And then all of a sudden, jump forward 10 years and 20 years, maybe that person's the chief nurse at a hospital, right? So there are requirements along the way, right? And there are opportunities along the way to really take that clinical path and turn it into a leadership path. The other path, the non-clinical, myself, I don't like blood or any of that stuff, is to really get exposed to the operations, how the hospitals or healthcare works. And there are just so many great associations and groups that really bring folks together in a non-clinical way to really talk about best practices over here. We're really good in healthcare about stealing great ideas, and we should, right? We're all trying to do the same thing. And we have a, real confidential, small, group where we can just say, boy, how are you dealing with this, issue, or what happened after you did that? And it's a great kind of ongoing relationship. Specifically around healthcare, what I would suggest is, if you're non-clinical and you want to kind of see how healthcare works and be a part of it and kind of test that, start at the bottom, right? Be a patient transporter, right? Get some good tennis shoes, get hired to move patients around the hospital. You're going to learn how the hospital works. You're going to get to know everybody, right? You're going to get to have some contact with patients, right? And that gives you a flavor as that's something that I want to do. Hospitals and healthcare are for some and not for others. You know, you got to kind of figure out if it's a place that you want to spend your time. And then, see and choose and try to seek out mentors along the way. And I put an S on the end of that on purpose. There's never one mentor. I've had several over the years, still have some that I rely on. It started with that consulting company way back at the beginning, and bounce ideas back, have them push you in areas that maybe you're not so comfortable with, and take opportunities along the way. Don't worry about the money at the beginning. It's hard. Don't worry about the title. I know that's hard. Everybody wants that. It does not matter. It will come, and it will come in ways that will be much more meaningful down the road. It was the best 4 years, seriously, that I can imagine. I had the best time, learned the most, and met lifelong friends. It's hard when you're, 22, 23 years old to imagine, pushing ahead decades, that these are people that will, be with you forever. It's just, it's an amazing experience. I'm lucky enough that I still have very close friends, and also just kind of that connection to the U of A is really incredible. I'll tell you, when I took the position here at Sharp and they made the announcement, I bet you I had 20 or 25 Wildcats reach out to me to say, "Welcome to Sharp. We can't wait that you're to meet you. We can't." And this was physicians, this was staff level. They were just people that found me on Twitter or whatever and said, "We can't wait to meet you, welcome." It just is a great way to start a relationship. I do think that, take advantage of the fact that you're going to have friends and colleagues that are going to go in different directions, and, probably a completely different career path. Keep in contact, right? They're going to have a career path to maybe ask questions about how that happened. Doesn't matter about the specifics, it matters about the path. So I just take advantage of the fact that you'll never graduate from college again.